Research shows diabetes is the number 7 leading cause of death in America today. In 2012, 29 million Americans, or 9% of the population, had diabetes. These statistics are meant to show the dangers of diabetes as well as how common it is. The goal of my presentation is to discuss what diabetes is, explain the different types of the disease, talk about signs and symptoms, and how to live with the disease. So what is diabetes? Diabetes is an autoimmune disease in which the body does not produce or properly use insulin, a hormone that is needed to convert sugar and carbohydrates into energy. When you eat sugar, it is dumped into the bloodstream. Then the pancreas secretes insulin to counteract the sugar in the blood and convert it into energy. In people with diabetes, the pancreas either doesn't produce insulin or it can't produce enough to convert all of the sugar. When diabetes isn't controlled with shots of insulin, it can lead to heart disease, kidney disease, nerve disease, and even amputations. Now that we know a little bit more about the disease, let's discuss the different types. Type 1 diabetes usually develops early in life. While there is no cure for this type, it is important to manage insulin levels. Imagine that all the cells are a lock, and the insulin acts as a key. So without the key, your body can't unlock the cells to get them the energy and nutrients they need to survive. A person with type 1 diabetes will take outside sources of insulin through an injection. The challenge with this treatment is that there are many factors that affect the dosage, such as the amount of sugar in each food or exercise. For example, if you're eating a candy bar, you'll need a lot more insulin than you would need for a salad. Type 2 diabetes usually develops in people over the age of 35 and in people with a more sedentary lifestyle. Type 2 diabetes, the body produces insulin, but oftentimes it isn't enough, so the sugar will build up in the blood. Other times in type 2, the insulin will try to use the key, but it won't unlock the cells. Oral medications can be used to help the body recognize insulin and use it more effectively. Gestational diabetes develops during pregnancy. While there isn't a known cause, it's possible that the hormones released during pregnancy block the insulin in the mother's body. The gestational diabetes can affect the baby because it allows extra sugar into the placenta, and the baby's pancreas will work overtime to counteract the sugar. Treatments include special meal plans, exercise, but in some cases it's possible to take insulin injections. Do you have any signs? There are nearly 7 million people in the United States that are living with diabetes undiagnosed. If you have any of these symptoms, it's important to see a doctor. Excessive thirst and increased urination, fatigue, excessive weight loss, blurred vision, slow healing sores, red, swollen, tender gums, or tingling in the hands and feet. Hopefully you have learned some important information about diabetes. Because so many people are affected by diabetes, we need to be well informed on the disease. Diabetes is an autoimmune disease which the body does not produce or properly use insulin, a hormone that is needed to convert sugar and carbohydrates into energy. Type 1 is developed early in life. Type 2 is developed later in life, and gestational diabetes is developed during pregnancy. Managing diabetes can be a challenge in the beginning, but with the right balance of carb counting, insulin therapy, medication, and exercise, maintaining diabetes will get easier with time and practice. Lastly, if you are experiencing any of the earlier mentioned symptoms, please don't hesitate to see your doctor.